Assalamu alaikum. I am Sham Firas, your colleague from year 1, and today, inshallah, I will be going over the anatomy of the heart, some of its external features, and also some of the internal features. So, first of all, I'd really like to start with the Complete Anatomy app, since for the external features, it's useful to use such an app. So, moving on to the external features, first of all, I'd really like to start with the location of the heart before actually talking about its external features. So you have to know that the heart is located in the thorax, essentially between the two lungs, in a region known as the middle mediastinum. And this is really critical for knowing the relations between the heart and other structures, posteriorly and anteriorly. As we know, the heart is going to extend obliquely, so it's more or less just a bit rotated and tilted. It's not completely straight. And it's going to extend obliquely from the second rib almost to the fifth intercostal space, which is found almost over here. It's going to lie anterior to the vertebral column, so you can see that it's anterior to the vertebral column and posterior to the sternum, okay? Now, for the size of the heart, it's almost the size of a fist. Okay, that's all I have to know. Now, for the heart external features, it's really important to talk about the apex, the base of the heart, which is located over here, the surfaces and the borders of the heart, which I will be mentioning shortly. Now, first of all, the apex of the heart, as you can see, it is directed forwards, downwards, so more or less this is the way how you can see it, okay? And it's going to be directed forwards and downwards and pointing towards your left hip, okay? Now it's formed mainly by the left ventricle over here. It's formed by the left ventricle, and it's going to lie in the fifth intercostal space, and this is really important for auscultation purposes. The apex is not directly accessed, so when you open the chest, you cannot directly access the apex because it's going to be overlapped by the left pleura and the left lung. Okay, so the left lung, and of course its outer covering. Now, this is it for the apex. Now, for the base of the heart, essentially this is the base of the heart over here, and it's going to be directed backwards, as you can see, and to the right, because this is how the heart is positioned. So it's more or less just backwards and to the right, all right? And it's formed mainly by the left atrium, maybe a small portion by the right atrium. And it's going to lie opposite to the middle four thoracic vertebra. We know that the middle four would be about the fifth to the eighth, because essentially we have 12 thoracic vertebra in total. So if you want to visualize how this looks like, so just let me hide the scapula first. Yes, so this is the base of the heart. So almost it's going to start from the fifth all the way to the eighth thoracic vertebra, and this differs whether you are standing or lying. Okay, so if you're standing, this is going to be 6 to 9, okay, in an erect position. Now, let me just remove the skeletal components over here. Yes, so the base of the heart is related posteriorly to some of the structures located in the posterior mediastinum, and I already mentioned the significance of the posterior mediastinum. It contains certain structures that are going to lie behind the base. For example, the esophagus, descending aorta, which is the portion of the aorta that goes down, and of course the right pulmonary veins, which are going to supply the which are going to go into the left atrium, and they're coming from the right lung. All right. Now, why do we need to know the structures that are behind the base? Essentially because there are certain procedures that they use, and they make use of these structures. For example, certain ultrasound, which is through the esophagus, they can actually examine some of the posterior portions of the heart and certain pathologies. Now, the borders of the heart. The borders of the heart, we have an upper, lower border, right, and of course left. Now, for the upper border, it's formed mainly by the two atria, but we cannot really see the atria over here, maybe the right, but not really the left, essentially because they are going to be hidden by the great vessels. So we can see we have the superior vena cava over here, the aorta, the ascending aorta, and also the pulmonary trunk. Okay, so if we remove these great vessels, we can actually see the atria from the upper border. Now for the right border, the way I like to visualize it is that I'm drawing 2 points and I'm just connecting them with a line. Those 2 points are going to lie on the superior and inferior vena cava, and connecting them with a line, this line is going to show us the region that is spanned by the right border, which is essentially the right atrium. Okay, now for the left border, it's going to be formed mainly by the left ventricle, as we can see, and a small part of it is going to be formed by the left auricle and not the left atrium, because as I said, left atrium is even behind the right atrium. Okay, now for the lower border is essentially this part of the heart, and it's going to be formed mainly by the left ventricle, as we can see, small part of it by the right ventricle, but formed mainly by the left ventricle. And I'm not really sure if you can see or visualize this, but there is a slight concavity over here, a downward concavity that's going to accommodate the upward convexity of the diaphragm, since we'll later be mentioning that the heart is going to lie atop the diaphragm, so it has to fit onto it, right? So this is kind of concave. The diaphragm is kind of convex to the upward direction, so this is going to help it lie on top of it. Okay, now moving on to the grooves of the heart, which are narrow regions of the heart that are most of the cases going to help in accommodating the coronary vessels, arteries and veins. We have the atrioventricular groove, which is located over here. From the name atrioventricular groove, it's going to separate the atria, or the upper portion of the heart, from the ventricles, or the lower portion of the heart, and it's going to contain the right and left coronary arteries, and these arteries are actually going to give us branches, okay, that are going to supply different regions of the heart. So here we have the right, for example, coronary artery, it's going to give us a marginal artery, okay, and so on. Now we have the anterior interventricular groove. So we have two interventricular grooves, anterior and posterior. This is the anterior interventricular groove. It's going to lie on the sternocostal surface of the heart. So the sternocostal surface, I'll be later talking to you about it, but this is the sternocostal surface, which is facing the sternum essentially, and it's going to basically have this anterior interventricular groove. It's going to contain the left ascending artery, or the anterior interventricular artery, and of course whenever we have an artery we have a vein along with it, running along with it. So in this case it's going to be the great cardiac vein. Now we have, as I said, the posterior interventricular groove, which is this groove over here, and it's going to contain the posterior interventricular artery and, of course, another vein, which is the middle cardiac vein. All right. Now, this posterior interventricular groove is seen on the diaphragmatic surface of the heart. Now, what I mean by diaphragmatic surface is that this is the surface that is going to lie on top of the diaphragm. And this is often confused with the base. So they are completely two different things. This is the base, and this is the diaphragmatic surface, the region that's going to sit on the diaphragm. Okay. Now moving on to the surfaces of the heart, I believe this is the last external feature. So for the surfaces of the heart, we are going to have the sternocostal surface, which is the surface that you see from an anterior view, and it's going to be divided by the coronary groove into an atrial portion and a ventricular portion, lying on top or below the coronary groove respectively. For the atrial portion, it's going to be formed mainly, as we can see, the right atrium, however, a small portion of it by the left auricle, or the auricle of the left atrium. Why not the left atrium? Because this is where the left atrium lies. It's completely behind the right atrium, so we cannot really see it in an anterior view, or the sternocostal surface of the heart. Now, the ventricular portion is going to be divided into two portions. Essentially, the right, or the portion that is spanned by the right ventricle, which, as we can see, is essentially the majority, 2/3 almost, and 1/3 is formed by the left ventricle. Now, the diaphragmatic surface, I spoke to you about what it is exactly. So this is the diaphragmatic surface, and it's going to lie on top of the diaphragm. However, you have to know that it is going to be related to certain structures of the diaphragm. And I will be using a picture to illustrate that. So this is the diaphragm, okay? And this is an anterior view. This is the diaphragm. We have the central tendon, which is the tendinous part over here in the middle. And we have the central tendon essentially surrounded by two domes, the right dome and the left dome. And the heart is going to be related to the central tendon, and because of its position, it's going to be kind of also in relation to the left cupula or the left dome of the diaphragm. All right. Now, moving on to, again, the Complete Anatomy app, we have to appreciate the right and the left surfaces of the heart. So the right surface of the heart is essentially what we are seeing over here. It's formed mainly by the right atrium, and of course this right atrium is going to be covered by or surrounded by other structures and covered by the pericardium. So other structures that we can see associated with the right atrium, we can see the right phrenic nerve and right pericardiacophrenic vessels, arteries and veins. And just to see how these look like exactly. All right. So, for example, let's see the artery, which is very related to the right surface of the heart. This is the artery. And of course, we have veins and we have nerves associated. The same thing applies to the left surface. The left surface is essentially going to be spanned by the left ventricle, as we can see, mainly by the left ventricle, and a smaller part by the left atrium. And again, it's going to be related to the pericardium and all of the neurovascular structures that we can see over there. So I believe this marks the end of the external features. Now moving on to the PowerPoint presentation for illustrating the internal features of the heart and some of the external features of the atria and the ventricle that I would like to illustrate on the PowerPoint presentation. So for the right atrium and the left atrium, they are going to have an auricle, which is believed to increase the volume of the blood that can be, held in these atria. And the auricle is going to have a rough inner wall, and which is from inside, and the quinated outer margin that we can see over here. You can see these kind of indentations or quinations. This is the quinated outer margin of the right auricle. Now for the right atrium, we can see the sulcus terminalis. Sulcus terminalis is essentially the same as the crista terminalis, but it differs whether you're seeing it externally or internally. What is the sulcus terminalis? It is basically a groove that is going to extend between the opening of the superior vena cava and the opening of the inferior vena cava. So this is the sulcus terminalis. And I'm afraid you cannot really see the sulcus the crista terminalis. It's essentially just the sulcus terminalis viewed interiorly, okay, the interior view of the heart. Okay, now the interior of the right atrium is going to be formed by an anterior rough part, okay, and a posterior smooth part. Anterior rough part, again, whenever we see something rough, so we expect to see muscles over there, which are referred to as the pectinate muscles. And the posterior smooth part is going to basically help in receiving. It's basically where the atrium is going to receive the blood, the venous blood, whether it is the blood from the superior vena cava, inferior vena cava, or also the coronary sinus, which is nothing but a big cavity or sinus that's going to contain all the blood that drains from the different veins, coronary veins of the heart. Okay, now the interior of the right atrium, we should also appreciate the septal wall. The septal wall is essentially the interatrial septum, or basically the wall that's going to separate the two atria. There we can see the fossa ovalis and the annulus ovalis. Fossa ovalis is essentially just a remnant of a structure that used to be present in the embryonic development, which essentially was the foramen ovale. Now we know early in the development, there were no lungs, right? So in this case, in the circulation, the blood had to pass between the two atria, and what allowed this was the foramen ovale, a structure known as the foramen ovale. However, with the development of the lungs, we did not need the structure anymore, so it remained as a depression. And this oval depression that you can see over here is the fossa ovalis. Now, whenever we have a depression, we have it encircled by a margin, or more or less just the portion that is protruding, which is the annulus ovalis, or the limbus of the fossa ovalis. It's the same thing. Okay. Now moving on to the left atrium, again, it's going to contain a cavity and an auricle. It's going to lie behind the right atrium. It's more or less just forming the base of the heart, and it's going to be hidden. So if you see it from the upper border, it's going to be hidden by the different great vessels. It's related to the oblique sinus. Now, what is the oblique sinus of the serous pericardium? It's essentially just the cavity that is formed when the serous pericardium kind of folds over the pulmonary veins. Okay, now once it folds over these pulmonary veins, it's going to create this sinus, which is very, very close to the left atrium, found at the posterior part of the heart. Okay, and of course the fibrous pericardium that is going to protect it from the structures in the posterior mediastinum, like the esophagus, for example. Now, the interior of the left atrium is slightly different from that of the right atrium in the sense that it's going to be smooth, so it won't have any pectinate muscles. In this case, the pectinate muscles will lie in the left auricle, all right? Now, the wall is going to be a bit thicker than that of the right atrium, and it's going to contain different orifices. For example, the mitral orifice, which is the opening that allows the blood to flow from the left atrium to the left ventricle, and the openings of the openings that are going to allow the blood to flow from the pulmonary veins all the way to the left atrium, and the vena cordis minimi, which are the basically veins that are going to drain directly into the left atrium. So these are the openings that you can expect to see in the left atrium. Now, the right ventricle is going, as I said earlier, it's going to form most of the sternocostal surface, and it's clear in this picture that is forming most of the sternocostal surface. Part of the diaphragmatic surface, essentially just the right third of it, and inferior border of the heart, almost right 2/3. I already mentioned these, so I'm not going to be, stressing a lot on these right now. On top of this, we have to know that any ventricle, the right and the left, they're going to have a smooth outflowing part and a rough inflowing part. So in the case of the right ventricle, it's going to have the smooth outflowing part referred to as the infundibulum, which is going to lie just below the pulmonary trunk, and it is conical in shape. Okay, now there's another structure that you have to appreciate in the interior of the right ventricle, which is the supraventricular crest. Now, the supraventricular crest I can't really show on this diagram, but I have a picture of it, which is over here. This is basically just a muscular ridge that is going to separate the tricuspid orifice from the pulmonary orifice that leads into the pulmonary trunk and the pulmonary arteries, and this is the supraventricular crest. Okay, this portion. Now, moving on, the inflowing part is going to be rough, as I said. So we have smooth outflowing, rough inflowing. The outflowing is going to be above the supraventricular crest. The inflowing is going to be below the supraventricular crest. And why is it rough exactly? Because we have papillary muscles and we have slight projections formed by muscles, and these projections are formed and known as the trabeculae carneae. Now, why do we need these structures? Mainly the papillary muscles, essentially for the valve function. So we can see that these are going to, along with other structures, going to help the valves stay closed in certain, periods of the cardiac cycle. Now, the inflowing part, as I said, part of it is going to be formed by the papillary muscles, which are going to be attached to the ventricular wall at one end, and the other end is going to be attached to the chordae tendineae, which are essentially very thin cords that are going to help attach the papillary muscles to the cusps of the valve. In this case, three cusps, because there is a tricuspid valve that is connecting the right and the right atrium and the right ventricle. Now, because we have three cusps, then we expect to see three different parts or three different papillary muscles. We have anterior, posterior, and septal. Septal is essentially going to be attached to the septum, the interventricular septum. And we have anterior and posterior, which are going to attach to the anterior wall and posterior wall respectively. As you can see, anterior and posterior wall. Now, the outflowing part I already mentioned is basically going to be the smooth part that leads to the pulmonary orifice. Another name that you have to note down is the conus arteriosus. All right, this is the smooth part over here. Now, moving on to the left ventricle. The left ventricle, I did already mention all of these contributions by the left ventricle, left 1/3 of sternocostal surface, left 2/3 of diaphragmatic, etc. But again, you have to know the smooth outflowing part, which is going to be the vestibule. It is just the equivalent of the infundibulum, but in this case, in the left ventricle. And it's going to lead into the ascending aorta, arc of aorta, and of course, the branches of the aorta. Now, for the left ventricle, I think we already know that its walls are basically 3 times as thick as those of the right ventricle, essentially because the left ventricle is going to pump the blood that is going to supply all of the body regions. Now, therefore, we expect that the blood pressure is going to be extremely high, okay, which is contributed by the left ventricle. Now, in the cross section, as we can see over here, we can see that the cavity enclosed by the left ventricle is going to be circular, while that formed by the right ventricle is almost like a crescent. Why is that? Because the left ventricle is way thicker than that of the wall of the left ventricle is way thicker than the wall of the right ventricle, and it's going to more or less just bulge into it, okay? And this is what creates this appearance. Now, just like the right ventricle, it's going to have a rough inflowing part, which is due to the presence of trabeculae, carneae, and the papillary muscles. And one thing that you have to note here is that the trabeculae carneae are more numerous than those in the right ventricle. And here we only have anterior and posterior papillary muscles, essentially because the left ventricle is connected to the left atrium only by the two-cusped or bicuspid valve or mitral valve, okay? Now, the anterior papillary muscle will connect to the anterior cusp of the valve, and the posterior papillary muscle will connect to the posterior cusp of the mitral valve, okay? Now, so for the inflowing part, it's basically spanning the region from the left atrioventricular orifice or just the mitral valve all the way till the apex of the heart, okay? So this region over here from the mitral valve all the way to the apex is going to be spanned by this smooth, rough inflowing part, and then we will have the smooth outflowing part. Now, why do we have rough walls? Again, due to these structures, okay? Now, the outflowing part, aortic vestibule, why is it smooth? Because it doesn't have the muscles. However, it is going to be like encircled by the fibrous tissue. So instead of muscles over here, we will have fibrous tissue. Why do we need the fibrous tissue? Just to make sure that the aorta is going to remain patent, and we need this patency for the flow of the blood during the systole or the ventricular contraction. Now, the skeleton of the heart, essentially just to keep everything in place, and of course, other functions of this skeleton, we have fibrous rings that are going to surround the valves, the mitral and the tricuspid valve, and of course, the origins of the aorta, okay, and the origin of the pulmonary trunk, okay. Now, these circles or these rings are going to be connected together by trigones. So we have the right fibrous trigone, which is more or less connecting the right atrioventricular ring with the left atrioventricular ring, and the left fibrous trigone, which is connecting the left atrioventricular ring to the fibrous ring of the aortic valve. Now, these uh, fibrous skeletal structures or fibrous rings are spanning the membranous parts of the interventricular septum. So this is the region where we don't see muscles, but rather we see fibrous tissue, okay? Now, the skeleton of the heart is really important in, as I said earlier, making sure that all of these openings, the valves and the openings that lead into the aorta and the pulmonary arteries remain patent, and at the same time prevent them from being overstretched. It will provide an attachment for the myocardium and the valve cusps, just to make sure that there is a coordination between the valve function and the muscle contraction in different periods of the cardiac cycle, and it's going to help in insulating. Uh, the the electrical insulation is really important, as this will help the atria contract and then the ventricles contract, so they don't contract together. Okay, now that's it for today. Thank you so much, and I hope you enjoyed the session. Make sure to reach out to me whenever you are hesitant. And yeah, thank you for listening.